Hi guys, welcome back to another vlog. So today's vlog is really different than anything that I've ever done before. As you can probably tell from the thumbnail, today I am going to a fertility clinic to get some blood work and an ultrasound done. If you guys do not know, I have PCOS. I did share my diagnosis story on my channel, so you can go ahead and check that out. I will put it up here. That was in like 2020. So it's been a while since I've even talked about it or been open about it. But we're 32 years old and we're not ready for a child yet, but we're family planning, just in case. So I just want to know, like, what is going on, if that is a direction that we want to go in, like, what do I need to do? And I just really do want to know, like, what's going on in my body. I did have an ultrasound before when I first got diagnosed. This one's a little different because I have to be on my cycle in order to get the ultrasound done. I've partnered with Annandale OBGYN and Fertility here in Northern Virginia, and I'm excited. So yeah, guys, let's go on this journey. I am a little nervous. I don't know why I'm nervous, but I am. So basically what I'm doing is seeing if egg freezing or IVF or any of that is possible. If you are not familiar with PCOS, you just need to go watch my diagnosis story. I really go in depth about it. But pretty much it's a hormonal imbalance, causes like irregular cycles, and sometimes it's harder for women to get pregnant. There's different types of PCOS and different like symptoms that people have, but that kind of just like sums up PCOS. It's a hormonal imbalance. So yeah, I've been managing and all of that. Like I said, we're not trying to have a baby right now, but we're in our 30s now. I was in my 20s when I shared my story, and we just need to see what's going on, and just plan out our future, whether we want children or not. It's good to just have those options. So I just want to take you guys along on this journey today, and let's see what happens. On the elevator, coming up. Oh, I need to press the button.
Happy face already. Let me chew. Blood pressure is for 2 minutes. Okay.
I just put up my paperwork. I'm waiting on the doctor to have my consultation before we do my ultrasound. I got my blood drawn. She took so much blood from me. She took 2 vials. Ooh, I didn't like a G with needles. Didn't even hurt. She was like, "Really? You're smiling?" It doesn't hurt. It's really nice in here, clean. I'll try to like record as much as I can. So I'm also filming content for Instagram because, like I said at the beginning of this video, I did partner with them, so I have to record my experience to post for Instagram. So it's a lot like going on, but I'm really grateful for this opportunity because I've been wanting to do this, and it's something that just happened organically, and we love that.
Hi, my name is Samantha Stern. I am a fertility PA and one of the co-founders of Annandale Fertility.
This is my vlog, and I told them what we're doing today, but I've never done it before, so I was kind of just expressing that I was kind of nervous about it because it's something new and it's finding out what's going on with my body. So it's a little nerve-wracking, but I'm ready.
Totally. I think a lot of people are nervous. I think when we're talking about fertility and we're talking about hormones, it's not something we're used to talking about. So kind of the initial reaction is to be nervous, which is very normal. I am very much someone who's like, information is power. When you have the information, then you can kind of change your plan and do something with it. But if you don't have the information, then you kind of don't know what to act on. So even if you don't necessarily get the results you want, at least you're in a place where you can figure out kind of what to do moving forward. So for, any of your followers who are scared, it's always better to have the information, and hopefully they can partner with like a good OBGYN or good fertility provider that can support them on whatever journey that they're going to take themselves.
I was also explaining how I'm not trying to have a baby anytime soon,
Right.
But it's better to know what's going on to try to figure out my options.
Absolutely.
For the future, if that is something that I wanted to do. What are the options?
Yeah. Well, first of all, it's always good to check your fertility. So a lot of people ask when's the right time to do that. I always think kind of like late 20s, early 30s is like the perfect time to do that. Whether or not you're planning, whether or not you're kind of like want to have a baby the next year, you don't, at least you kind of get a baseline in your late 20s, early 30s about where things are at, and then you can kind of plan moving forward. So I think it's good for people who are just kind of curious about where they're at, people who are kind of forward thinking. If you feel like anything is off, so if you have irregular periods, if you feel like you may have hormone imbalance, if you're having a lot of irregular bleeding or no periods, or if you've ever been diagnosed with PCOS, anything that seems a little bit abnormal, it's still kind of good to be evaluated and just see. And you don't have to do anything, you can have the information, and if you don't want to have a baby for 5 years, you don't have to, but at least you kind of have a baseline. So there's kind of a lot of options. The first is we kind of do testing, and numbers look good. You don't really have to do anything. You just say, okay, numbers look good. I've got a couple more years and I continue living my life and growing my business. And then, I kind of have a baby or start trying when I'm ready. There's also some options for fertility preservation. And this is things like egg freezing, embryo freezing. It's getting a lot of kind of traction in the news. A lot of celebrities are doing it. Jennifer Aniston talked about her experience. There was just like a big 60-minute special on it, that more and more women, especially in the DMV area where women are career oriented, they're highly educated. It's a hard place to date and meet people, but women are kind of putting off, having babies for one reason or another. And you have options to kind of preserve your fertility. So option one, if you're not in a relationship or if you're not, totally committed to somebody, is doing something called egg freezing. And the optimal time to do that is kind of 28 to 32. You have some time beyond that, but we see that kind of the egg quality goes down after 35. So you can still do it beyond 35, but kind of the sooner the better, because you can capture the eggs when the quality is really good. If you're married or in a committed relationship and you're 100% sure you're going to have children with the person that you're with, then there's an option to do called embryo freezing. And that's a little bit different. That's where we get your eggs. We then take your partner's sperm. We put it together, we actually fertilize the egg, create an embryo, and then we freeze that for future use. And typically that has a little bit higher chance of having a good outcome and good pregnancy success in the future, because eggs, when they're by itself or not fertilized, are very fragile. They're one cell, they're kind of by themselves, and they don't always hold up super well in the freezing and thawing process. So the guidelines tell us we have to freeze a lot of eggs for each pregnancy that you may want in the future. But embryos, they've already kind of divided. They're about 5 days into their kind of division process, so they hold up much better. So you typically have to do fewer cycles. You have to freeze fewer embryos than eggs, basically. So those are some kind of preservation options. that you have, and that kind of buys you a lot of time. So if you don't want kids for 10 years, and you have frozen eggs from when you're in your early 30s, late 20s, and you don't have to worry about being in your 40s and how that's going to affect fertility, basically. So it's really a great, I always call it an insurance policy. Still kind of try on your own. If it's not happening, then you have those to use, basically.
Okay. See, that's good to know because I didn't know the difference between just freezing the eggs and the embryos. I thought it was all just the same thing.
Yeah. If you're not in a relationship, then you don't have any sperm to use,
Right.
so then you just freeze eggs. But if you're a committed relationship, you're married, you're with somebody 100%, then embryos are a good option.
So when you do embryos, do you take less eggs than you would if you were just freezing eggs?
We still take the same number of eggs, but sometimes we have to do fewer cycles. So the guidelines tell us that we should freeze 20 eggs per pregnancy that are desired. A lot of women won't get 20 eggs at one time. Maybe you get 5, maybe you get 10, maybe you get 15. So that may mean you have to do multiple cycles of egg freezing. Whereas if you were to freeze embryos, say we get 10 eggs, if you get 5 to 7 embryos from that, we freeze those. And those are 5 to 7 embryos that have a real potential to become pregnancy. So you have to freeze fewer. So maybe you have to do only 1 cycle of embryo freezing instead of 2 or 3 cycles of egg freezing, basically. Lots to think about.
Yeah.
Insurance, unfortunately, typically does not cover fertility preservation because it's totally considered elective. But, it depends kind of on like your insurance plan. Sometimes they'll cover medications or the ultrasound or that kind of thing. But we're not at a place yet, unfortunately, where like fertility, whatever it is super, super well covered. So when you're thinking about kind of what I should do before planning for pregnancy and just kind of testing our fertility, there's a number of things that we could do. So the first test that we always offer and that we're going to do for you today is something called a baseline ultrasound. And what that is you come in on your period. We typically do it between day 1 to 5 of your period. You'll hear it often as like day 2 or day 3. And we do specific hormone blood work on your period. And then we do a vaginal ultrasound or a transvaginal ultrasound. We want to do it specifically on our period because on your period, we know exactly where your hormones should be. So if I just check you at a random point, it's hard for me to say if your hormones are normal because I don't know exactly where in a cycle you are. But if we do it on your period, I can tell you like without a doubt, hormones look good or they don't look good because we know on your period what is normal for that time. During the ultrasound, we do something called an antral follicle count also. So we look at your uterus, we look at your ovaries, and we actually, very cool, we count the follicles on the ovaries. And the follicles are like, basically, they're like little sacs that have the egg in them. You can't see the eggs on the ovaries, but when we count the follicles, which are the little egg sacs, that gives us a sense of how well your ovaries are working. So if we don't see that many sacs on the ovaries, that tells us that you may have something called diminished ovarian reserve. Ovaries are not working super well. And that's when I would probably guide somebody, hey, maybe you need to speed up your timeline because ovaries for some reason don't look like they're working as well as they should for your age. So we kind of count the follicles on the ovaries. Or we can see a lot of follicles on the ovaries. So if we see a lot, then that can clue us into something like PCOS. With PCOS, you have this kind of classic appearance where the follicles line up around the periphery or the border of the ovary and they form this like string of pearl sign. That's the cyst that people always talk about. And I hate the term PCOS because people think they have all these like big scary cysts on the ovary. That is not the case at all.
When I was diagnosed with it, I had an ultrasound done, but I wasn't on my cycle for that. It was just a regular ultrasound, vaginal ultrasound, and we were looking at the screen. I mean, I didn't know really what I was looking at exactly. I was there kind of like, do you see this, that? I'm like, okay, but I didn't have any cysts.
Okay.
Then I don't know like what could have happened since then, but there was nothing. Like I didn't really get any feedback at all. I was kind of just told to change my diet.
Got it. Do you know how they made the diagnosis of PCOS?
I went to the doctor when I noticed I didn't have my period for like 3 months.
Got it.
And I kind of told her that my lifestyle changed. I used to be like really active, and then I took a job where I was working at a desk and I was sitting for hours, and then they would always buy food, and I'm just eating, but I'm not exercising. So I kind of put on weight very quickly. I noticed when I gained weight, my period stopped.
Yeah.
She kind of just diagnosed me.
Got it.
Then she was like, yeah, it sounds like this. And she's like, well, you're trying to have a baby. And I'm like, no. She's like, well, you need to get on birth control. And that's like the typical thing that they tell everyone.
Yeah.
I did do the birth control, but then I got off of it because I just didn't like it.
Yeah.
I pretty much just changed like my eating and how active I was.
Mm-hmm.
And then my period started. It was regular.
Awesome.
And I lost the weight. But now I'm feeling my cycle is a little different. I don't know if it's because I'm in my 30s now, or is it because I'm not working out as much as I was.
Yeah.
Because I kind of slowed down on that too.
Right.
I haven't been eating that well either.
Right.
So I'm like, I don't know. Like, but some of the other symptoms that typically they say people with PCOS have, I don't really have. After she said that, and I'm like, okay, well, I changed everything. And I'm like, maybe she lied to me. Like, I don't know. Like, because we didn't see anything on the ultrasound. I don't feel any way. I just feel like I got fat and my body didn't like it.
Yeah.
So, but I don't know. So now I'm kind of like, no, I think it may be. You may have. I don't think the doctor's gonna lie to you.
Yeah,
but
right. So maybe get you some clarification.
Yeah.
So PCOS is a syndrome, polycystic ovarian syndrome, and I really don't like I said before, I really don't like the name of it because it makes people think they need surgery, they got all these cysts on their ovaries, and that's not what it means. It just means you have a hormone imbalance and you may not be ovulating every month when you're supposed to. So because of that, the eggs, instead of being functional, are dysfunctional, so we call them cysts. But they're not scary. You don't need surgery. Like, it's just you have a lot of eggs and they're not kind of being released when they're supposed to. So it's very common. We think about 10 to 20% of women have it. I see it multiple times, like probably 3-4 times a day in my office. So it's incredibly, incredibly common. There's actually a criteria that we can use to diagnose it. So, it shouldn't be like just this, like, I think you have it. There's actually like a criteria that we can follow. So there's a diagnostic criteria called the Rotterdam criteria, and it looks at 3 things. So the first things it looks at are your periods. Are they irregular? Are they not? Are you getting them? Are you not? So patients who like go a year without a period, that's not normal. That tells us something hormonal's going on. So, kind of regularity is piece 1. Piece 2 is the ultrasound findings. So do your ovaries, when we look at them on ultrasound, have this kind of classic polycystic appearance, that string of pearls thing where we see lots of eggs around them. Not everybody has that. Some people have a really bad hormone imbalance, but their ovaries look fine on ultrasound. And then piece 3 is kind of hormones and what your hormones look like on blood work. So oftentimes women with PCOS will have elevated testosterone, and elevated testosterone can cause a lot of the symptoms. And the symptoms that women can have, and just like you said, not everybody has the symptoms, and it can appear very different in different people. The classic kind of appearance of PCOS is women may be overweight. They have a higher BMI. They can have abnormal hair growth, particularly on the face. We call it hirsutism. So almost like beard hair. They can have hair on the chest. They can have like bad acne, hormonal acne, particularly on the chin, and then the irregularity. So those are kind of like the 4 very classic symptoms of PCOS. But I have very like thin women who have a very low or normal BMI who have PCOS. I have women who have no acne, no abnormal hair growth at all. And it's interesting, we have this kind of like blanket diagnosis of what PCOS is and what it looks like, but actually in different racial populations, we see it present very differently. So it really should be like, in Caucasian women it's this, and Black women it's this, and Asian women it's this, but of course that is not how we function in medicine. But it's very common. 10 to 20% of women have it. We do see it more in, if you gain weight, you're kind of more likely to have it because fat can actually have an impact on your hormones and kind of throw off your hormones, so you're more likely to have it. So it is something that can be kind of correctable. We care about PCOS kind of for 3 reasons. The first reason is when you have PCOS, you're at higher risk of metabolic syndrome. So things like diabetes, gestational diabetes when you're pregnant. There's a slight increased risk of like cardiovascular issues. So we want to know about it because we want to know long term how can we keep. So piece one is kind of metabolic risk. Piece two is if your periods are super, super, super irregular, that can actually affect that can actually affect the health of your uterus. So if you're going 3+ months or even longer than that, you are actually at a higher risk of developing precancer of the uterus, and then could even lead into cancer of the uterus. So we typically want you to get a period like at least every 3 months to kind of flush out all the tissues. So if there are any bad cells that are kind of developing, they go with your period. And then piece three is it can have an impact on fertility. And the reason that it can have an impact on fertility is one, we do think that the hormone imbalance may affect egg quality a bit. And two, if you don't have a regular period and you're not releasing an egg every month, well, how does the sperm then inseminate anything if there's no egg there? So oftentimes, these are all kind of correctable things, right? We can manage weight and a metabolic disease. We can give you medications to get a period. And there's things that we can do kind of manage for fertility. I can't tell you how many patients that I've had who were diagnosed with terrible PCOS. And they're like, you don't need to be on birth control. You're not going to get pregnant, no chance. And they come in and they're pregnant. And they're like, the doctor told me there was no chance.
Yeah, and that's why I hear that a lot. And then when the doctor was like, well, are you trying to get pregnant or no? Because if you are, then she was saying that I would have to do like fertility treatments. And she's like, but if not, you need to get on birth control. And I'm like, if I need to do fertility treatments, why do I need birth control? Because you're telling me that I'm not going to get pregnant naturally. So what is the point of the birth control?
Exactly. I think for a long time, we would throw birth control in with PCOS to help regulate the period. And the birth control can also help with a lot of the symptoms. It can correct the hair growth, correct the acne, exactly. But I think we're moving away from that because it really slaps a Band-Aid on it. It doesn't do anything to correct the hormone imbalance from inside. It just says, okay, if you're on this, we're kind of like correcting things, but it's not intrinsically helping. So I have at our clinic here, we've got like a very strict algorithm that we follow of lifestyle changes, supplements, prescription medication that we can put you on that can really help. And oftentimes we'll put people on this, they do it 3 to 6 months and they don't even need help getting pregnant. They just get pregnant on their own. But unfortunately, it is something that I wish we just had like one pill that I could give you and it would correct it, but it is something you kind of do have to be, very strict about it, intentional about it. Yeah.
I've done it before, but I fell off the wagon.
Yeah. And it's worked for you, clearly. Did you do ever like gluten-free, dairy-free, anything like that?
So I did dairy-free. I didn't go full gluten-free, but a lot of the stuff that I was eating, I was like making sure it was gluten-free.
Yeah.
And I also stopped eating meat for a little while, for like 6 months.
Okay.
And that did make a difference.
Okay.
But I think for my body, like I need meat.
What kind of prompted you? Like, how did you decide what diet changes to make?
Google.
Okay. That's good.
And the doctor, she told me, she's like, look up the South Beach diet.
Okay.
And I kind of followed it, but then I was like, well, I want to just try being vegan.
Yeah.
So that's kind of just how I fell into that. I don't eat red meat anyway, so it wasn't really hard to like not eat meat. But I eat like chicken and turkey, and I know that may be a problem because of like hormones that are in chicken.
Yeah.
So
it depends like where you're getting your chicken from, if they're doing a lot of antibiotics and hormones, and like how much chicken you're eating. Like if you're eating like a couple chicken breasts a day, that may throw off your hormones. But if you're doing it like, a few times a week and you're not eating like huge volumes, it probably doesn't have that much of an impact. Chicken. Do you?
I do. I think that I'm supposed to eat fish. For my blood type. I kind of looked up like what are you supposed to eat for your blood type, and I think I'm supposed to eat fish, but I just don't like it.
Yeah, I get it.
I think I maybe need to take like fish oil or something to like kind of supplement that into my diet, but I haven't started that yet.
Yeah, there's 2 diets I'd like. One more for fertility, one more for PCOS, but they do have some overlap. So for fertility, for both egg and sperm quality, so this goes for men too, we recommend the Mediterranean diet. And I'm not super familiar with South Beach. There may be some overlap, but it's basically like a whole balanced diet. So it's like a lot of fruits and vegetables, healthy fats. So fish does fall into that category, but like avocado, olive oil, nuts, that kind of thing. Not a lot of processed food, not a lot of red meat, not a lot of like carbohydrates and junk. So it's just kind of like making good choices. But we do see it as a very positive impact on egg and sperm quality. So there's like real evidence-based research to show that. And then for PCOS, the reason I asked, because you were actually kind of doing exactly what I recommend to my patients. I'm a huge fan of gluten and dairy-free. So we see that gluten and dairy are very inflammatory. And when you're consuming kind of food that's inflammatory, you're making kind of your body's inflammation worse. That's more likely to throw off your hormones more. So I always recommend gluten and dairy. It's very hard. I tried myself for a year. The dairy is like nearly impossible, I found.
It just doesn't taste the same
taste so good.
either.
I know.
But I think my taste buds kind of just adapted
Yeah.
to it.
Yes.
Because other people are like, how are you eating this dairy cheese?
The vegan cheeses.
I'm like, I don't know. It's a mental thing.
Yeah. But the gluten is, I found not to be so hard.
Yeah, now it's not.
Yeah.
I think back like in 2020, it kind of was.
Yeah.
And that was during the pandemic too. So everything was just, it was a lot.
Yeah. And some other kind of recommendations we have just for PCOS. So I always talk about diet. When you're exercising, there's some evidence that shows like weight-bearing exercises are better than cardio for women with PCOS. And my patients are always worried they're going to turn into bodybuilders. And I'm like, it's very hard to become a bodybuilder.
I love weightlifting.
Yeah, me too.
So I weightlifted in high school.
Yeah.
So, and I ran track as well. That's more cardio, but we also had to do strength building. So I love a good, like, slow weighted workout.
Yeah, exactly. Doesn't spike your cortisol as much. We see it's very good for metabolism. It's better for weight loss than people realize.
And you're not going to turn into a bodybuilder unless you're, like, actually, like, really wanting to be a bodybuilder. There's like a very strict diet and everything that they do.
Yes.
And I doubt you're doing that just by lifting like a weight or, you know.
Exactly. I weightlift like 4 times a week and I'm like, do I look like a bodybuilder? No, you will be fine, I promise you. But yeah, weight bearing exercises, the diet, and a different supplements. But the main one I really like is called myo-inositol. Have you taken that before?
Yes. So I have some at home actually.
Have you found it does anything?
I'm not sure.
Okay.
Possibly. I just take it just because I feel like I'm supposed to.
Okay.
I think it does help me a little bit with pain. Is not as high when I'm getting my cycle. Versus like when I wasn't taking it. So I don't know if that's like a thing that it can do. Yeah. Because like right now I'm on it and I'm just like fine.
Great.
Like I'm not in pain. When it came on, I felt it coming. Even last week when I was supposed to come, I like could tell my body was trying, like or it's on the way. But yeah, like when it came, I'm just like, oh yeah. I don't know if that has something to do with it.
If it helps with pain, that's it. Continue it. But it can really help kind of get people's periods more regulated too. So I recommend myo-inositol, and then some women we call metformin also. Have you ever been aware of metformin?
No.
Metformin is a diabetes medication, but what's nice about it is if you don't have diabetes, it doesn't like bottom out your blood sugar. So it's safe for people to take even when they're not diabetic. But a lot of women with PCOS, like I said, you're at higher risk of diabetes and metabolic diseases, so you can have insulin resistance and you can have elevated blood sugar. So taking the metformin, lowering the blood sugar, helping with insulin resistance can really help with hormone regulation. So oftentimes women who want to get pregnant, there's some studies that show like 3 months before you start trying, having metformin on board can really help with egg quality too. So usually like my patients who come in, they're like, hey, PCOS, I want to start trying in a couple of months. I usually get them on metformin in advance. But even if you're not trying, it can help kind of get periods more regulated too. And that's a prescription, so you do have to get it prescribed by somebody. It's very safe. The downside is a lot of people have like gastrointestinal discomfort, like bloating, cramping, nausea, that kind of thing. So that's usually why people, if they stop it for that reason. But it's very safe long term. Yeah, that's kind of like my main regimen for PCOS. Lifestyle stuff, some supplements, some prescriptions. And my patients who are like dedicated and are really committed to like the diet and the exercise often do do, as you've seen, often do very well and kind of can correct a lot of the hormone imbalance.
Like I said, I've fallen off, but I'm ready to like get back because I feel like I've gained not the weight back. I don't think I'm as big as I was. I'm petite. I've always been very skinny, but like some people are like, you don't look, you just got like, everyone's like, oh, you have grown, you got your grown women curves now, or grown women weight, but I'm like, it doesn't feel good,
right?
So it can't be good. Like I just like my bones can't handle any extra weight, so I just want to get back, not back to my like high school weight or anything, but just feeling comfortable, in my body, and just having everything good, regulated.
It's just about feeling good. Like sometimes when you're on, my patients who do the PCOS regimen, like that comes to me 3 to 6 months later, and they're like, I just feel a lot better. I feel less inflamed. I feel like
energy.
Exactly. I'm sleeping better. I'm less stressed. I'm less fatigued. Like everything just like I feel more comfortable in my skin.
So I will say that the supplement, I don't know how to say it. How do you say
Myo-inositol.
Myo-inositol, okay, does help actually.
That's
Now that you say that, like energy and things like that, and I've also started taking like vitamin D.
Awesome.
I feel like I have more energy now than I was having before.
I will say you've done, I think, a very good job with your research of like piecemealing all of this together. I think most people, it's much harder to kind of like find this and like to stick to it. So you like have done a good job of figuring this out. But probably a lot of your followers, like, no one's ever said to them any option besides just like birth control.
Exactly. Yeah. So when I did my initial video, when I was talking about my diagnosis story, I was on birth control then. And I kind of like told people, well, my doctor just put me on birth control. Like I didn't have any more information to give because that's what I was given at the time. So now, 5 years later, we have more information. So I would like to like just share with people that that doesn't have to be the answer. Like there's more. And then kind of just sharing how I kind of reversed some things.
Totally.
Also talk about how they can come back if you don't stick with it.
Exactly.
Because I've fallen off, I've gotten back on. It's been a journey. So.
Right. And as we get older, it's harder to stay on the bandwagon.
It's
stressful. And,
There's just so many moving pieces, and sometimes I don't put my health first.
Yes.
I'm ready to just get back to just being strict about my health.
I think that's great.
I'm ready to find out what we have going on.
All right, let's do it. So we'll do your ultrasound, and we'll see what the blood work shows, and we'll go from there. Get undressed. Okay. Waist down. Pants underwear off. Totally fine that you're bleeding. You're going to sit up here on this pad. This kind of opens up like a blanket. Just going to keep you covered more for modesty. So you're going to put it over your lap, and then I'll give you a couple minutes to be back in.
Gotta get undressed.
I had it before, so I think I'm okay. I'm getting the ultrasound done, guys. There's the screen.
You're going to scoot your hips down all the way. Okay. So you're going to feel some cold jelly, a little bit of pressure here.
I'm already jumping and didn't even do anything yet.
All right.
Okay.
So that is your uterus. Measurements to make sure everything's measuring correctly and appropriately. Your uterus is in the normal position, which is kind of facing towards the front of your body. We call it anteverted. So this is kind of a side view of the uterus. And then this is kind of more, I call it like a bird's eye view. We call this transverse view there. This is your endometrium. This is the lining of your uterus. This is where pregnancy grows, right here. That is your ovary. Right here, this little structure is your left ovary.
Wow.
Each of these black spots is the follicles. That's that little sac that holds the egg that we were talking about before. And I do think your ovary looks what we call polycystic.
Okay.
So women with PCOS, they have this appearance called the string of pearl sign. And basically, the follicles all kind of border around the periphery. So you see, it almost kind of looks like a necklace around the ovary. Women who don't have hormone imbalance, the follicles are kind of just like randomly interspersed throughout the ovarian tissue. So to me, your left ovary does look a bit polycystic, I would say. Take a couple measurements.
The lady didn't lie. Explain.
So we're gonna go and count the follicles or the eggs now. So you have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. You've got like over 20 on the left side, which is great. So anything above 5 is good. Less than 5 tells me ovary is not working super well. We're gonna check your right ovary. So here is your right ovary here. And then, yeah, I would say you've got kind of a similar appearance here on the right ovary, the string of pearl sign here. But I don't see any of those like big scary cysts.
Okay, that's good.
You've got about 18 on this side. So yeah, looks great. It's about 38 follicles or eggs that we see total. You have more than that. Those are just kind of the ones that we can see. Those are the ones that are up to bat, basically. Oh, not so bad, right? That's it.
There's no blood.
I took the condom off.
Oh.
I do it quickly. No one needs to see that.
Okay, that wasn't so bad. It wasn't bad at all. I learned some new things about my body.
Oh. This is our IVF lab. This is andrology. This is where we do all of our semen analysis, sperm prep, sperm wash for IUI and IVF. And over here,
Very sterile.
it's all sterile. And we can't go into the IVF lab, but in here is where we do all of our embryo creation, egg freezing. Can you see under there?
Yes. Is this what separates the plasma from the...
Yes,
Yes.
yes. We don't use it for that in here, but yeah, this is actually we spin sperm in here.
Oh.
Yeah, to prepare
Okay.
it for different procedures and things. Yeah.
So
This is the sperm centrifuge
the med spa that I used to work at, we had this
for
for...
therapy.
Yes.
Yeah, yeah, it's actually the same thing. I think the numbers may be a little bit different. This is our procedure area. This is our HSG room, our X-ray room. So this is a test that we do to check and make sure your tubes are open. So if you're trying to get pregnant or struggling, we do an X-ray to check tubal patency.
Mm.
And then this is our procedure room. This is where we do all of our egg retrievals for IVF and egg freezing. And this room is connected to the lab. So when we get your eggs out, we just pass it right
Through the window?
Yep.
Oh,
And freeze them from there. This room's a little scary, but it's where the magic happens. This is a fun room. This is our collection room.
I was going to ask.
Yeah. So for our
Oh my God.
Yes. We got a leather chair, an iPad, some nice
headphones.
meals. Yes.
I don't even want to stand. It's clean.
So when you come to do your semen analysis, this is the
Oh my gosh.
that's the room.
You guys, it's done. So still waiting on, I have to wait like a week for my blood work to come back. But this was a very educational experience. It was really, I did not press the button in the elevator. She's really sweet. And why is there a star next to 2? Am I supposed to go to 1 or 2? Anyway, she's really sweet and very informative and gentle, and I think I'm on the wrong floor. Definitely the wrong floor. Close. That's why this dude had the star. We discovered some things. I learned some things about my body. Some stuff I'm not gonna share. Nothing bad. There's nothing bad, guys. But now we're at the point where I just decide what I'm gonna do. And yeah.